So the Richard M. DeVos Medical Excellence Award is an award that is given to someone in the medical profession that has really dedicated their life to the improvement of the community's cardiovascular health. I think very important because this is really embodying Rich DeVos, the community, making the community better, and his kind of lifelong dedication to heart disease, kind of combining those two things together. Really, if you look at it, we've had incredible improvements in cardiovascular health. If you look at cardiovascular versus cancer, a dramatic 25-30% reduction in heart disease. And that's come about by the community working with the medical profession, and I think having an outstanding working relationship, and really the results that we're seeing here today.
Well, as a vascular surgeon, Dr. Mansour treats the arteries and veins of the body outside of the brain and the heart, and he's responsible for decreasing many people's stroke risk and saving many lives actually through the treatment of aneurysms and saving limbs through the treatment of lower extremity disease of arteries. Well, it's really interesting to think about how Dr. Mansour has such a strong connection with his patients. It's not uncommon that I'll hear, or people in the office will hear, about how his patients want to see only him because they're so connected to him. And I think it's over the years he's meant so much to the patients in terms of how he's reduced their suffering and saved their life, or maybe even help decrease the risk of them losing a limb. And I think it's his warmth, his caring touch, how he is very humble and unassuming, but yet people also understand and know of his expertise and his tremendous talent as a surgeon.
Dr. Mansour and I met in the cath lab. My husband had been in for another cardiac catheterization, and after that it became evident that we needed some assistance, and Dr. Mansour was called in. So I met him in the cath lab, and when I first saw him, I saw it in his eyes, in his mannerism, in his smile. There was such confidence there, and he explained what we would be doing. I felt so comfortable with him. I shall not forget the calming atmosphere that he presented himself with when he explained what was to be done. His eyes, his smile, I just felt so comfortable with him. My husband and I and my family were so blessed to be the beneficiaries of the talent of Dr. Mansour.
I think what it really means for Grand Rapids is that we have seen this evolution, and it's really kind of mirrored ASH's history here, to be starting out with just clinical work, but then to expanding this into research and in education. And it's really what ASH has done, it's what our medical community has done. So we were at one time just hospitals, and now we are medical institutions, and now we are educational and research institutions. That evolution over this last 2 decades is really what Ash Mansour has dedicated his time to here. It's what the entire medical community has dedicated themselves to, and really what the medical institutions have dedicated themselves to.
Well, Dr. Mansour is a fascinating person. He can speak to almost any topic that you can bring to him. He is a lifelong learner. I think many people don't know that he just recently obtained his MBA. And as little as recently as last year, you could find him on the beach in Costa Rica surfing. So he's a man of many talents. I think many people think about their legacy as they age and as they go towards the end of their career. And the thing that is remarkable about Dr. Mansour is that he's established that, and he established his legacy, I feel, years ago. And he's still practicing. He still has yet to even to go further. But he has meant a tremendous deal to this community. He's a builder. He has built our residency program. He's built our fellowship. He has not only excelled clinically, but he's excelled in research. He's excelled in education, and that has been just a huge asset, I think, to our community.
Some of the milestones that I've seen over the last 20 years have been the tremendous changes in minimally invasive surgery and procedures that we are able to perform on patients. I can remember when I was a resident taking care of patients with aortic aneurysms, and they were very sick after the surgery and spent days and days in the hospital in an intensive care unit. And now we are able to do the same procedure under local anesthesia, and most of the patients go home in a day or two. So I think that that's a tremendous advance in cardiovascular surgery.
So Ash, I'd just like to congratulate you on receiving this award. Very well deserved. Thank you for your decades of dedication to all of your patients, to all of us, and to all of our community. So thanks, Ash.